let's go straight up to sharing the screen. Right there. Yep, I have already downloaded the first exam. We are full today of a bunch of MRIs from the emergency. A bunch of them are already delayed, so we can't waste much time. This is a hypophysis, a pituitary gland MRI. I just downloaded the images so I could test if my connection was fine. I haven't had the opportunity to, to properly look at the exams, the images. So this is a 42-year-old male. It says here it's contrast enhanced, and it makes no sense because this is some kind of epileptic seizure case and dizziness, and they ordered a pituitary gland scan. Why? Yes. Oh, it says on a previous CT scan, someone said he had an empty Sella, an empty Turkish cell. So it is what it is. So as you guys can see, the cell, the Turkish cell, the pituitary site is right here. It isn't empty. It has a gland inside of it. Also, it's reduced. It's concave, and there is invagination, inward motion, inward positioning of the diaphragm, and it is a partially filled Turkish cell right there, filled by cerebral spinal fluid. So this is quite common in patients of over 60 years of age, not so common on such young patients, especially male patients. This is a flare for the skull, for the entire brain, which makes no sense in this case, but it is what it is. Let's just get this over with, and so we can go to the next exam. I'm going to put the T1, sagittal T1 right here. Grab a coronal T2. The positioning of the scan is wrong. It's twisted and small position, but still we can kind of tell. This is the neurohypophysis. Oh, I'm sorry. This is the neurohypophysis right there. There is some heterogeneous bone marrow on the clavus. There is also sphenoid sinus inflammation, thickening of the mucosa, nothing major. This is probably the neurohypophysis, and the adenohypophysis is right here. This is quite yes, there is something here. No, I was wrong. This is something worth of notice. The neurohypophysis is right here. The rest is adenohypophysis. The pituitary stem is well positioned, and it's properly morphologically normal. And let's get a post contrast. There is a lot of movement artifacts, probably from the eyes, and sneezing or heavy breathing. So this is a very, very bad exam to evaluate, but maybe I can measure something right here on the right side of the adenohypophysis. Just going to, yes, confirm. It's quite like that. It's another axial useless sequence, and it's all shaky. This really isn't a proper exam to report. This is one of the worst exams I have ever seen in my entire life. Probably the worst exam I have ever seen of the pituitary gland. See, this is just freaking terrible. When you think you have seen the worst exams of your life, you'll be surprised how much people can put an effort to it and make it even worse. Just keep in mind, it can always get better, but it will probably get worse. So it's on the right side, it's ill-defined, heterogeneous, and it has been measured as 0.7 by 0.3 millimeters right there, centimeters right there. It's a late enhancing lesion. It is bright on T2 for some reason. Usually it is. And it's low signal intensity, heterogeneous on T1. It kind of enhances a bit on the margins. And it's enhancing late on if compared to the rest of the pituitary gland. So, considering how bad this exam is, we have done a lot. We have done much more than we are supposed to do. The pituitary stalk right here, it's a bit shifted to the left, and the lesion is on the right, so it makes sense. Let's describe the lesion and go to another exam. 0.7 by 0.3. Yep, slight shift of the pituitary stalk or stem. How is it called? I can't remember. I just remember hastes hypophysaria in Portuguese. How is it called in English? Is it stalk? Stem? It's stem, not stalk. Pituitary stalk. Yeah, the pituitary stalk is slightly shifted to the left. And we are done here. This is probably a microadenoma, a pretty small benign tumor of the pituitary. If it's less than 1 centimeter, 10 millimeters, we call it micro. If it's over that, we call it macro adenoma. And if it's exactly 1.0 centimeters, we measure it again. So we are done here. Let's